We've been talking about rare diseases today in mostly scientific terms. That is, after all, why we're here, to share, learn, collaborate, and hopefully move closer to cures. But let us not forget the real reason we're here, the patients and families impacted by these rare diseases. So here's a brief reminder of what it's like to live with a rare disease, so that we don't lose sight of the ultimate goal, alleviating their suffering.
We had these amazing, they're still amazing. We had these amazing children who are normal in every way, full of life, exuberant, driving us crazy, but we're loving every minute of it. And then one night, it's almost like a thief broke into our house, and he started stealing pieces of our son. He'd come one night and take a few words, and at first we didn't notice. But then as it added up, he took more and more words. A few months later, he took Noah's ability to walk, and he started stumbling more. Within a few weeks, that ability was totally gone. The thief came back. A few weeks later, took his ability to eat. It's taken his ability to see, to talk to us. It's now, at this point, taken nearly everything.
Noah Van Houten was a normal, happy 3-year-old when he started having seizures, the beginning of a devastating downward spiral that led to a diagnosis of Batten disease, a rare genetic disorder that causes progressive brain degeneration. It is a terminal disease with no cure. 5 months after Noah was diagnosed, one of his younger twin sisters was also diagnosed with Batten.
It is a cruel, cruel disease. No parent should have to go through this. No child, more importantly, should have to go through this.
Olivia Birtwistle was a bright, vivacious 7-year-old when she suddenly went blind, often the first sign of Batten disease.
These kids, they're bright. They have dreams and want to do all these things, and then to see them robbed of it is one of the most devastating things. This is the disease. This is not what Olivia would choose to be like. And I think that's really what's so frustrating for these kids is they know what's happening, and they know what they used to know, and they can't do a darn thing about it.
We just need some help. We need some people to get interested in this, and we're determined to make it a difference in this disease.
A very different but no less devastating rare disease is often called butterfly disease. That's because the skin of these children is as delicate as the wings of a butterfly. But unlike butterflies, there is nothing beautiful about this disease. 14-year-old Jonathan Petra is a butterfly child. His mother recalls when she first heard the medical term for her son's disease.
Jonathan was starting to have little blisters on his hands. We didn't know what was causing it, and by the time we got to CHEO, he stopped breathing because he had blisters all of his in esophagus. They did a skin biopsy in which came back saying that Jonathan had EB, which is epidermolysis bullosa.
EB is a genetic connective tissue disorder that leaves children with skin so fragile that the slightest touch can cause blisters, tears, and open wounds that are easily infected. This is a brief glimpse of life for an EB family from a Barcroft Media profile of Jonathan and his mom.
The day-to-day challenges of EB is everything, really. To eating, to walking, to getting dressed. This condition is very rare. My skin in general, the wounds had gotten bigger, deeper, and now they're chronic wounds, which means that they never leave.
Wound care is an arduous, hours-long daily undertaking for all EB children.
The bath is horrendous. It takes a very long, 3.5 hours, approximately, sometimes 4, sometimes 3, depends. The pain has gotten dramatically worse.
He soaks in the bathtub with salt, pool salt, and Javex. Javex being a disinfectant in the pool salt. Once he were done removing all of his dressings, he soaks in the tub for a few minutes just to have a bit of soaking time. We get him out of the tub, we walk to the room, and it's doing the dressings over again. So we start from the feet up, so that eventually once I have covered his bottom, he can actually sit down, because it's very hard for him to stand for a long time. He tries to imagine what a day without pain would be. I can't even picture myself in being that amount of pain every day of my life.
Jonathan knows EB will likely take his life by his mid-20s. Yet despite, or perhaps because of his EB, Jonathan is wise beyond his years.
I'm already past half my life. So when you think about that, you know, it gives you a new perspective. That's why you should live life to the fullest. That's why you should not, always, think about what you don't have. Think about what you do have. Think of all the happiness around you. Think about all the love, not all the negative stuff. Think about the positive stuff, and you'll be a very happy person.